Welcome back, ladies and gentlemen. Now we are going with chapter 40, talking about obstetric and gynecological examination. I hope everyone can find the slide in front of you. Okay. Okay. Now we need to know what is the points we need to know about this. Gynecology and obstetric practice is differ here in this country, that we have the two doctors are separate categories. We are not like having the same like in other countries. Other countries, the gynecology and the obstetric doctor is the same. The same person can do the same job. But here we have like this specialty to be like separated from each other. So the gynecological examine the female reproductive system for any disease or any problem or trouble. But the obstetrics focus on pregnancy and childbirth. Gynecology practice is very important to be know that women may be see general practitioner or schedule for appointment with gynecologist for a pap test. And this pap test is very important for us to know what is pap test, and we are going to talk about it in more details. PAP is the abbreviation for a person or a doctor who create this test. We call Pap Nicolau. So his name is Pap Nicolau, and we are using the abbreviation or the shortcut to be the word PAP. And this Pap Nicolau make like cervical examination to detect early malignancy. What this? It is developed by George Pap Nicolau in 1883, and this test is used to detect cancer of the cervix and used to screen for atypical cytology. Cyte means cell, ology study of. So any atypical means we have a letter A here. So this means not normal, not typical. So any abnormal changes in the cell, which we know as cancer, can be detected early before it will be like well established. So what we need to get familiar about this, we have to learn and we have to educate the patient what is the required for this test. It is very important to make scan to detect early problem with the cervix. You as a medical assistant, you have to prepare the patient for such test by make schedule at least 5 days after the menstruation period to avoid any risk or any abnormality in taking the result from the cell. So after the menstrual cycle stop, and this will be 5 days after, normally the menstrual cycle took the range, according to the books, it is 5 days. So after 5 days, we can make the appointment. We have to avoid scheduling during the period, this very important items in the exam, and avoid the following 48 hours prior to test to do what? Tampons, birth control foams, jellies or creams not be used 48 hours prior. Dosing, you will say that, oh my goodness, I can't go to the doctor without taking doses. No, this is not accepted because we need to get the discharge from the vagina, and according to this, we can go to test any abnormality. But sometimes the lady going with a she already having doshes for the vagina, and her vaginal secretion is like free from any infection, but actually she is infected. So we have to avoid this also. And also sexual intercourse should be like prohibited before 48 hours. Exam table, we know that we have to put the patient in a special position, which is lithotomy position. And this lysotomy position is important for gynecological examination. And we have to prepare the room and the examination according to this mentioned here, that place exam lamp with reach of the examiner tool. Why? Because we need to make like good illumination to the field when we are using the colposcope. This is the tools. And when we have chance to be in class, we are going to prepare the tray for pap smear, and you have everything mentioned. I give it to you in the hard copy for the pap smear and all the trays responsible for you to be prepared. And we have items, and these items, as you see here, if you can see my cursor, this is the colposcope, which is plastic and it is disposable. And we have here the cytobrush, and this is the spatula, and we brush the cervix cells by this cytobrush, and we collect the cells by the spatula, and after that we put it on glass slides to be examined under the microscope. And we have a lot of equipment, a lot of tools to be added to the tray, and according to this we will be ready for every item to be examined, and we will collect the discharge from the vaginal wall. So put in your mind, discharge coming from the vaginal wall. So this is very important item, and cells are going to be collected from the cervix. So don't get confused and say that we collect cells from the vaginal wall. Wrong. We collect cells from the cervix, but what we collect from the vaginal wall is the discharge. And as I told you early, we examine also the vaginal acidity during this test also. Of course, we have to be sure that the patient is in comfort position, and we have to give certain instruction to the patient by examination. If the patient has no previous experience about this test, so give her what is the test exactly, what is the procedure, and we have to prepare her for this test without getting panic, without getting feel discomfort, and so on. Also, as we mentioned, we have to know how to produce self-breast examination, and also this very important. I am going to send you the video from YouTube after we're done with the picture with the lecture today. And again, remember this position, lithotomy position. As you see, guys, the lady in lithotomy position, and this is the pelvis, and we use the vaginoscope. The vaginoscope has to be inserted in a special way. I will learn you how to use it in lab, and it is self-retaining, so we open it, and once we open it, we separate the anterior wall from the posterior wall, and we can see the cervix here. And from the cervix, we will collect our cell sample. After the examination, you as a medical assistant help the patient feel comfort, also help the patient to come out from the examination and come out from the table and dress their dressing, and after that help them for follow-up of the appointment, follow-up, and you make the schedule for that in front desk. After that, you have to clean the examination room and wear gloves to protect yourself when you're collecting the samples, and restock the supply and place the labeled specimen, which is very important, and attached request or requisition from the proper area of pick up, because we don't need to make like mismatching between the patient sample and the patient name. So make it early and in front of the patient to be sure that this is related to this patient. Another gynecological procedure, like we do dilatation of the cervix, and this is what we call D and C. D for dilatation, C for curettage. So we can dilate the cervix and make curettage to the endometrium to get the sample of the endometrium. And also we take this procedure by the following tools, which we call uterine sound. What is uterine sound? It is a tool. It will guide me what is the position of the uterus. Because sometimes, guys, the uterus actually, this is the front, the uterus is like bent forward. So this is normal. And also it is turned to the right side. So normally the uterus is flipped forward and to the right side. So this is the normal for the uterus. So sometimes we have abnormality, like the uterus is opposite and the opposite direction. We call it retrograde or levo. It is on the left side. So these are abnormalities of the uterus. We can detect it by the use of uterine sound. So what is the job of the uterine sound? It is to detect what is the direction and what is the position of the uterus. Of course, we can use the ultrasound, and this ultrasound also will guide us what is the actual position and direction of the uterus. The curette is a tool with sharp edge, so we can insert it inside the uterus and we scrape the endometrium so we can get the content of the endometrium for analysis or to stop bleeding if we have a case with menorrhagia. So we have to stop the bleeding. How? By scraping the endometrium to stop the bleeding, and this is another operation for D and C. Sometimes we need to take biopsy from the tissue of the uterus itself. So this is by the biopsy forceps. For the obstetrics, as we mentioned, take care of pregnancy and take care of the birth process. What is the medical assistant rule in obstetric? Number one, document information completely. Stressing complaints with a checkup. Provide patient education and answering questions. So this means you have to be well educated to learn people and answer their questions thoroughly. Otherwise, you will give mis-answer or bad opinion. So it is not opinion, it is science, it is knowledge. So you have to give correct answer to the patient. Okay. What about the provider? Sometimes of the provider, they are like perinatal, means before birth, complete examination. So before birth, we have to examine the lady, weight, height, and urine examination and blood sample, and take care of everything with the woman before or while she is pregnant. And we do complete examination. And sometimes we ask some lab tests, especially kidney function. And sometimes we are caring about, like there's a disease we call toxemia of pregnancy, which happen in the last 3 months of pregnancy, and this will make trouble to the lady. If it is not controlled, the blood pressure will be increased and edema all over the body, and the kidney will be also affected much. Like we mentioned, pregnancy, as you know, roughly speaking, it is 9 months, and we subdivide these 9 months into a trimester, and the trimester is first, second, and third, and this is the ranges. The first trimester from week 1 to 12, the second from week 13 to 28, the third from week 29 up to 40. Normal pregnancy range between 37 up to 41 weeks. And we have Nagel's rule, and this Nagel's rule for estimating the date of delivery. So this is what is the due date. And this is very important for every pregnant woman. She needs to know what her due date. So how we go by this? Number one, start with the first day of last menstruation. Then subtract 3 months because the year is 12 and we need like to be 9, so we subtract 3. And add 7 days plus 1 year, so this will be the due day for this lady. And this is question exam also. They gave you the ideas or what is the first day of last menstruation, and it was like whatever the date, and you'll ask it about what will be the due day, so you have to know the rule. After that, we are going with regular examination, and you have to read like how to go with such, how to check the chart, ensure all the lab reports are present, ensure all the studies of referral letters are completed, and prepare the patient for provider examination, of course. So it is like any regular care of patient, but with certain focus on certain lab tests and certain position of examination and certain common disease happen with pregnancy. So this is very important in the prenatal visit. Okay. That's the most important topics for today. If you have any question, let me know. If you have already satisfied by this lecture, let me know. And I will send you, stay online, I will send you now the study guide for tomorrow exam. Any question?